my background is in holistic nursing and wellness coaching. So when I'm looking at patients, I'm looking at them holistically. And, we all work with individuals that have pain. And that's, obviously, and we ourselves often encounter pain. So this is something that, in my mind, there are so many pharmaceutical options out there for our patients. But what we wanted to do was look at how we could bring together some complementary modalities. So the booklet that you have in front of you, which is probably in much better shape than the one that I have, actually just kind of covers some basic modalities that are free for our patients to use in their homes. And I also invite you to check them out and run through them on your own to use either for yourself or to do along with your patients. So the way that I have them listed is, I've explained to other groups, they're listed alphabetically. But what I'm going to do is I'm going to kind of skip around, scratching the surface of 5 of them and then saving the last 3, breathing, relaxation and breathing, yoga, and meditation for the very end. So if that's okay with everybody, it will take about a half an hour. We'll get through this. If you have questions, please let me know. So I'd like to start with some of the very basic food and water options. When we talk about food, the first thing when we go into patients' homes, and I know when I've gone into patients' homes before, first thing they say to me is, don't tell me to stop eating McDonald's. Don't tell me to give up my soda. And I say to them, I'm not. That's not what I'm here for. What I'm here for is to look at other options for you. What are things that we can add into your diet that are good? And what I have found is, as we build different food groups into their diet, some of those other things fall aside. I don't know, I'm kind of a partial to this restaurant in Rochester called Core Life. Has anybody been there? And I ate there yesterday for lunch. But it's a great restaurant. It's all organic food, and it's wonderful. And when I eat there, I feel fantastic. If I ever eat at McDonald's, oh my goodness, it's like my body revolts, which, and sometimes McDonald's, it's fine in moderation. So when we talk with patients, we want to look at what are some healthy choices. We want to eat a lot of fresh fruits and vegetables, lean proteins. What we want to try to help them do is cut down on the amount of salt, sugar, caffeine, alcohol, processed foods, dairy. And again, things in moderation are okay. I have coffee every morning. I'm sure most people drink coffee, drink a few beverages, and that's okay in moderation, but we want to make sure that, especially when they're dealing with pain, that they're looking at their intake. So we want to keep them eating foods that are fresh, that are wholesome for them. Does that make sense? And then as we move into the next category of water, water is one of those unsung heroes. And oftentimes people will say, well, I don't like the taste of water. I'm not really sure what water tastes like. It doesn't really have any taste. But sometimes people don't like the thought of just drinking water. So there's other options that we can help them with as well. You can get a lot of water from fruit. Watermelon, any of the melons, strawberries, anything like that. Cucumbers are wonderful sources of water. And I tell people all the time, mix your water, infuse your water. Cut up some strawberries and throw it into your water, or cucumbers, or even lemons, which I know lemons are more of a diuretic, but still, to add some taste to the water, it's always good to enhance that. The other thing too is people will say, well, what is a good amount of water to intake? 8 glasses of water a day. 6-ounce glasses, 8-ounce glasses, 12-ounce glasses. It kind of varies. And if you weigh 60 pounds, or you weigh 300 pounds, your needs are going to be different. So a good gauge that I tell people is take half of your body weight and convert that to ounces. So easily, in my mind, because math is not my forte, but so you try to keep it easy. You weigh 150 pounds, 75 ounces of water a day is a good gauge for you. Does that make sense? And I tell people all the time, water is a wonderful, wonderful modality because it's so multifunctional. When you drink, you're hydrating your cells. You're flushing out the toxins. You're hydrating your joints. All right. When we have people that have arthritis pain or they're post-surgical, those are people that especially can benefit from water because that water's hydrating their joints and also improving the integrity of their skin, so helping their surgical wounds to heal better. All right. Any questions on food or water? No? Everybody still with me? All right. So I want to move into the next three categories. I want to talk about massage, I want to talk about prayer, and I want to talk about journaling. Okay, and again, these are all modalities that people can use at home that really cost nothing. And even the journaling can be very low cost. I tell people it doesn't matter if you're using a red crayon on a roll of toilet paper. If you can get thought from mind to paper, it's beneficial. All right, so while we're talking about journaling, I'll go ahead and talk about that a little bit more. I encourage people to journal, and not from the perspective, I've told the other groups that I've been to, in my former life, I was a newspaper editor, so my background is in English. When I was starting to journal, I was a terrible journaler because I was so concerned about what if somebody read my journal? What if my sentence ended in a preposition? What if my grammar was, not proper? Then what do I do with myself? It doesn't really matter. It really doesn't. The thought is to get those thoughts on paper, to write down your thoughts. When people do that, they can start to see sometimes the reason with the pain. They can look at their reaction to pain. As they're writing, they can also look at things they've done to rid themselves of pain. And I encourage them to date their entries so they can look back and say, wow, when I was going through this is kind of where my mind was, but here's where I am now. Or these are some things that exacerbated my pain, and here's what I did to get over it. So it's a nice, as you go back and read, it's almost like a story, if, for lack of a better word. So you can look at that, and don't worry. Don't get caught up in what does it sound like, what does it look like, is my writing good, is that my sloppy handwriting, is that my good handwriting? Again, it doesn't matter if it's in crayon, doesn't matter if it's bullet pointed, if you want to cut out pictures, anything that you can do to get your thoughts on paper. That's the most important part. So we really want to encourage patients to look at that, or you yourself. Does anybody journal in here? No? Yeah? Are you caught up in the whole English version of it? No. The rightness of it? No, right. Perfect. Whenever I think of it. Good, good. And it's nice when you're putting those thoughts down because it really kind of shows you. And it's almost, if people are working through a post-surgical situation, it's nice to watch that journey unfold. Sometimes we're in the middle of it. You can't really think clearly, but if you go back, you can say, wow, here's where I was and here's what I did to get over that. So maybe in the future they can use that information, or they can share those tools with someone else. All right? And then moving into massage. For most of us, I'm pretty sure most of us in the room, within our scope of practice, massage is something that we can do. That hands-on touch. And it doesn't need to be, as I've shared with other groups, it doesn't need to be you fold out the table, people get on there and they're there for 60 minutes. That's not what I'm talking about. What I'm talking about is taking the time to sit with people. And massage can be anything from gently holding their hand, rubbing their hands, rubbing their feet, rubbing their shoulders, forearms, their legs, but being mindful of touch. Not everybody wants to be touched. I'm pretty open. I'll hug anybody. I don't mind. That stuff doesn't bother me. Other people, especially if they've been a victim of trauma, you have to be very, very careful. You don't want to activate those triggers for them. You want to always ask permission. Not everybody wants you to put your hands on their shoulders, and sometimes I feel the same way. Like I don't really, I'll hug people, definitely, but I don't need everybody touching me. That's kind of an invasion of your space. And it's interesting that our society really is so touch deprived. And I shared this story years ago. I worked in a different field. I worked with adults and kids that had developmental disabilities. And when I was working in the group home, my first day of training, they said to me, and this was probably 25, 30 years ago, we don't hug people, we shake hands. You know, so when people come home after their day program, when they walk in the door, make sure you don't hug them, you just want to shake their hand. And I'm thinking, wow, you know, if they come home and they've had a bad day, and I say, wow, John, I'm really sorry that your day was bad. Let me shake your hand. How comforting is that to them? You know, sometimes people just need a hug. They need to know that they matter. They need to know that somebody cares for them. And sometimes just that gentle hand, you know, hand on the knee or hand on the shoulder, lets them know that you care. And it actually brings down their heart rate, brings down their blood pressure. Okay? And just some things to keep in mind, and I'm sure I don't need to tell you guys, if you're going to rub an area, if you're going to massage like a forearm or a leg, be sure you check that area. Make sure there's no open wound. Make sure there's no swelling, no redness, no tenderness. You know, it's probably not going to be very comforting if they have a surgical wound and you're rubbing your thumbs right over that surgical wound, or if they've got a sprained ankle and you're getting in there and you're rubbing that, not very comfortable. All right. Any questions on the massage piece? All right. Next one I want to cover before we get to the last three is prayer. And prayer is one of those topics that people tend to dance around. You know, we don't, it's a rule, and I'm not sure if it's in writing, I'm sure it is, but it's a rule that you never discuss religion and politics with people, right? Especially now, all of that conversation is off limits. But if somebody is hurting, somebody is in pain, oftentimes they draw their strength from their spiritual foundation. And when I'm talking about prayer, I'm not talking about Catholic prayer, I'm not talking about Hindu prayer, I'm talking about that connection to whatever it is that you feel exists out there, all right, that transcends religion. This is more spiritual. So when you're with somebody and they say to you, will you pray with me? What's going to be your response? Okay, good, good. Again, you have to step back and see where you are with the whole prayer concept, because people are very much, you know what? Somebody said to me in a conversation, if somebody says they want to pray, I want nothing to do with it. I say to them, you know what? Wait till I'm gone. And that's unfortunate because we have an opportunity to be there, to be present, to be fully present with the patients that we're caring for. So when somebody says, I'm sorry, were you going to say? Oh, I thought.
Please finish your thought.
Oh, yeah, don't interrupt my thought, I'll lose it. No, I thought you had your hand up. Okay, go ahead. Go ahead.
Well, I just want to reverse it. I mean, so if, other than suggesting to someone that prayer is an option,
Mm-hmm.
but it doesn't feel appropriate to me to say, will you pray with me, from our point to them,
Right,
right?
right.
Right, we agree on that, right?
Oh, yeah, no, is that what I said?
No, not at
Oh,
all.
okay, yeah,
I'm
no.
reversing it.
But if people,
How do you introduce the concept to a person?
a lot of times, and I don't know, maybe it's just my experience, people will say to me, you know, do you pray? Or do you believe in whatever? And that kind of opens the door. So I really just follow their lead. I don't know that I would ever initiate it. You know, but people will say to me, Liz, do you go to church? Or do you believe in God? And then that starts the conversation. I try to keep my comments very minimal because I want to follow their lead. If they say to me, will you pray with me? Absolutely. You tell me how I can best do that, you know, because my thought of prayer might be very different from theirs, you know. So what does that mean? If they're of a different tradition, then I want to know, how do you pray? And how can I help you with that? All right, maybe prayer to them is saying a rosary, or maybe it's just taking a few moments of quiet time, or maybe it's going somewhere or doing something. Then again, following that lead. And maybe your role in all of that is just holding their hands while they pray, or maybe sitting quietly with them, holding what I call that sacred space, that place where they can commune with whatever they consider to be the divine. All right. And again, like I've said to other groups, maybe your role in their prayer is sitting by the door so nobody interrupts them. You know, if they've got kids running around the house, or maybe they're in the hospital, or wherever their setting is, maybe it's just a matter of holding that space, allowing them that space in which they can pray. All right? And and I don't know how it is so much down here, but in Rochester, it's extremely diverse. You know, there's so many ethnic backgrounds, religious backgrounds, cultural backgrounds. And people oftentimes, even from within same cultures, follow different traditions. So ask them. You actually will honor them if you ask them about their traditions. How is it that you pray? What traditions do you follow, and how can I help you with that? Okay? All right, so any questions on what we've covered so far? All right, so I try to kind of skim the surface. I know everybody can read, so you can read a little bit more. These pamphlets are written in very basic English so that you can share with patients. All the information that's in here is evidence-based. There are so many studies that are out there, but I figure if patients are in pain, they don't really care where the information comes from. They don't care that studies were done at Mass General or at Harvard. They just don't care. What they want to know is this going to help me? All right. So I've written it, just like I said, just very basic to share the information. So what I'd like to do now in the last, wherever we are, 10 minutes or 15 minutes, I'd like to take you through a little bit of relaxation, a couple breathing moments, and then some chair yoga. So is there anybody who's not comfortable participating? All right. So what I think we'll do is we'll start with just some deep breathing. Can we dim a light without losing video?
Well, let me see, man. What do you got? Say it, lose it? Is that okay?
Is that okay? All right, so what I'd like to do is have people, we'll do a little bit of breathing to start, and then we'll move into the yoga, and then into the relaxation. All right, so if you're comfortable, go ahead and sit in your chair, scooching back, placing your feet on the floor, and just allow your hands to rest comfortably in your lap. All good? All right. And I just want you to take a few moments to notice your breathing. Don't manipulate it. Don't control it. Just notice it. Does everybody breathe deep into their belly? Or are we somewhere up here? Probably. When our patients are in pain, or when we ourselves are in pain, normal respirations are what, 12 to 20, give or take. People are in pain, those respirations can be off the charts. And they're breathing right up here. You know, I'm not even sure air is getting really into the lungs. So it's not doing them any good. They're not able to oxygenate their body. They're not able to bring that oxygen deep into their body where they can use it. So now what I want you to do, and if you're comfortable, you can close your eyes. And if you don't want to close your eyes, just allow your eyelids to lower. Take a nice inhale in through your nose, down into your belly. And then let it go gently through your mouth. And it might feel a little odd. If you're not a belly breather, your diaphragm might have a bit of a revolt. But that's okay. Just be gentle with yourself. Draw that breath in again. And let it go. And one more time. And let it out. Do you notice a bit of a difference in how you feel? Feel a little bit more grounded. All right, so I want to take you through another breathing exercise that on the surface looks a little crazy, but really what I try to explain to people when I teach yoga classes is our bodies are these energetic beings. So this energy is going like this all the time. When we do the next breathing modality, we're able to balance that energy. So I like to think about it. You know when you're a kid and you spin around in a circle and you go in the same direction and then you fall down and the room is still spinning and you probably are not really looking like you're capable of walking? That's kind of how when we don't pause to breathe right, that energy just kind of spirals out of control. The next breathing exercise is alternate nostril breathing. And what that does is it allows the breathing to go and then come back. So you balance yourself on an even deeper level. So take your right hand, take your peace fingers, your index and middle finger, place them at the top of your nose. And your thumb is right by your right nostril. So plug that right nostril and breathe in through your left. Plug the left nostril and exhale through the right. And then inhale through the right. Plugging that right nostril, exhale through the left. So that is one cycle of alternate nostril breathing. And you can do that a couple times. Maybe not necessarily when you're driving and your vision is blocked, but you know, oftentimes if you have a minute or two before you go in to see a patient and you're sitting in your car, just run through 1 or 2 cycles of that and allow yourself to be grounded so that when you're with the patient, you are fully with them, all right? And when we talk about employing those modalities, we're not looking to increase the time that you spend with patients, all right? I know your visits and your productivity, and I'm fully aware of that, and I know you have a lot to do. So these are things that you can do with your patients while you're working. If you're doing wound care, while you're getting your stuff ready, take them through a deep breathing exercise. Or if you're doing some therapy on them, encourage them to stretch using some of the yoga techniques I'll show you. And those things you can actually do as you're multitasking, all right? So I want to take you through a couple of the yoga poses, and they're considered yoga poses, but you don't have to be a yoga teacher to use them. They're basic stretching, all right? So the first one that I want to take you through is mountain pose. These are all poses that you can do in a chair. However, if people are able to sit or to stand, you can encourage them to do that. So first pose is mountain pose. So again, your bottom is on the chair, your feet are flat on the floor. And as you root those feet into the floor, you can have your hands down to the side, or if people have range of motion, they can bring those arms up. Either way is fine. A lot of people prefer the hands down here, either to the side or palms facing forward, and just allowing themselves to feel grounded. Oftentimes we tend to be a little flighty. We're all over the place. This pose, and if you're doing it standing up, you are so grounded in the ground. Your feet are rooted down. So everything from your waist down is grounded. Everything above the waist is open. Does that make sense? So you're able to kind of bring them to that point that they're able to be grounded. Next pose, sorry, I keep up and down, up and down. Next one is half moon pose. So if they have the flexibility, they can bring those arms up overhead. So if you want to go ahead and do that without knocking your neighbor, bring your palms together and then gently, this is where we go synchronized swimming. Take it to the right or left. If we all go the same direction, it's much smoother. And then come on up and take it to the opposite side. Good. Bring it back up. And release those hands down. Now, if they don't have that range of motion, they can bring their fingertips to their shoulder or just leave their hands in their lap and do that nice, gentle side stretch. All right? Next one is Cobra Pose. And I'm sure you guys notice a difference probably if you're sitting at your desk and you're typing and you're kind of like this and you're typing and you can't really breathe because you've crushed your lungs. When you're sitting up straight, you've got that direct line that goes right down into your lungs. As we move into Cobra Pose, we open that area up even more. So place your hands at the front of the chair, or if you're a little more comfortable and you can get them to the back of the chair, we're going to bring those shoulders back. So we open the chest, open the lungs, and if they're able to look up, that's fine. If that range of motion is limited in the neck, they can just look straight ahead, bringing that air in and letting it out. Good. So we move from Cobra into forward fold. And again, you want to be careful of where people's range of motion is. All right, if they're not able to bend forward, even just a little bend is good. If they're able to come down even farther, allow them to come down. They're gonna feel a nice stretch in their lower back. If you find that their belly is a little larger, they've just eaten, they can create some space between the knees and just allow that belly to sink down in. And if they are able to go all the way down, encourage that. Be mindful though, if they have issues with their blood pressure, you want to make sure they're keeping their head above their heart. Okay? Any questions on those poses so far? All right. Next one is hand to knee pose, or what they call knee hug pose. So when we do this, it is just what it sounds like. You're going to hug that knee. So you bring that right knee up. I'm sorry, scooch back out of your chair. You can bring that right knee up, and they can bring it up to the level that's most comfortable, or if they barely get it off the floor, that's fine. And you can encourage them to roll their ankles in one direction and then the other. And then bring up the other leg. So you'll be exhausted when you're done, right? And then roll that ankle. Good. All right. So any questions on that pose? And the last one is a spinal twist. So I tell people when we twist, oftentimes people try to twist from their hips. Your hips are not a twisting area. They bend, and they bend only. If they twist, then we have a whole nother set of issues. So when we twist, we're twisting from our mid-spine. All right, so you just twist to the side. Grab the side of your chair. If you're more limber than that, you can grab the back, twisting that body. And then bring yourself back to the front and twist in the opposite direction. And come on back. All right, so these are things, especially for people who are wheelchair bound or bed bound, just to get a little stretch and a little bit of flexibility can help to alleviate their pain. All right? So then the last thing that I want to take you through is just a little bit of relaxation. So again, if you guys will just hang with me 2 more minutes and then we'll wrap up. Go ahead and sit back in your chairs, just like we did with the deep breathing. Rest your hands comfortably in your lap. And again, I invite you, if you're comfortable, and this is another thing you want to say to them, if you're comfortable, close your eyes. Not everybody's comfortable. And if they don't want to close their eyes, they can lower their eyelids just so that their vision is just slightly blurred. Allow your shoulders to fall down from your ears. And as we move into relaxation mode, allow your mind to be clear of the chatter thoughts are going to come in, but just allow them to exit, knowing that when you're done with relaxation, you can pick those thoughts right back up. Allow your body to feel the support of the chair beneath and behind you. Drawing those breaths deep into your belly. And just take the next few moments to relax and breathe. And as we begin to come out of the relaxation, take a moment to just touch base with the body. Move your hands, your toes. And if your eyes are closed, gently open them. So those are just a few modalities that patients can use, and I would encourage you to try them at home as well to alleviate their pain. Any questions on the information? Any feedback? Anybody need a Kleenex to wipe the drool? Wonderful. Well, thank you very much for allowing me to be here at the meeting. If you have questions, I'm located, like I said, up at Empire. Feel free to shoot me an email or give me a phone call, and I can answer those questions for you.